So welcome to Let's Talk. Our session today is Building a School-Age Quality System. I'm Debbie Mathias from the BUILD Initiative and the Director of the QRIS National Learning Network. Before we begin our session, I'd like to thank the Alliance for Early Success and other generous funders for making this learning community possible. We began this series for state quality administrators and leaders to support their essential work within states around early learning quality systems building. Today we have colleagues registered from over 18 states and territories. We intentionally keep the sessions small to invite conversations and sharing. We hope the calls enable us to illuminate challenges, innovation, and promising practices. Now on to our topic. With much of the recent attention and funding opportunities, both federally and the philanthropy sector, focused on infants, toddlers, and preschoolers, it's extremely relevant to think about expanded learning opportunities as we look to the largest age group served by CCDBG in many states. The extremely interesting work from Washington around an accessible, equitable, and high-quality system for school-age and youth development programs is timely indeed. There will probably be many opportunities to think about and incorporate this information and the Washington learning as our child care systems ramp up to possibly include longer periods of time with school-age youth in our programs, in all types of settings, potentially in programs where school-agers really haven't ever been served before. All of this during the coming months. It's going to be interesting to see, and I'm sure you have school-age discussions around many of your tables back in the States. Well, as we were looking at our first slide for today, I said, look at all those infant toddlers across the top. We should have found some school-agers to put on our cover slide. And one of our panelists eloquently said, you know, those infants and toddlers will turn into school-agers someday. So with that thought, let's move to the next slide. Our agenda today will include introductions, some background about the project in Washington, the research and evaluation, how the work is playing out with professional development and coaching, embedding the school-age work for birth to age 12 continuum. Throughout the session, we'll have questions and discussions. So as you think of something, put it in the chat box, share your ideas, thoughts throughout the session so that we can respond to them when we have breaks in our content. I'd like to introduce our session contributors today. Juliet is the Director of Strategy and Partnerships with Cultivate Learning at the University of Washington. She oversees the center's programming and collaboration work. She's over 20 years of experience in early learning, child development, and education policy. Juliet's a strong advocate for equitable, quality early childhood experiences and policies that support healthy families. She leads the statewide Quality Education Director at Schools Out Washington. She oversees the statewide External Assessment Coordination System, supports Schools Out Washington's cadre of coaches, and is a liaison to the Weichert Center for Youth Program Quality. Before joining Schools Out Washington in 2009, Sheely ran education and teen programs for Boys and Girls Clubs in Tacoma and Seattle for nearly 10 years. And finally, Rachel Kendall Brown is the QRIS System Administrator at the Washington State Department of Children, Youth, and Families. She's responsible for policy development and statewide implementation of Early Achievers, the state's QRIS. She's been in the field of early learning for over 20 years and has served in several roles, from provider to coach to system partner. Rachel's a collaborative leader, and I can say that from experience, driven to advance racial equity by learning from the richly diverse communities in her state and continuing to examine and modify the state's quality system. Well, I'd like to welcome the three of you to be with us today and turn it over to Rachel.
Thank you, Debbie. Good afternoon, everyone. I'm really excited to be here and to share about the work that we're doing in Washington State. So, Jonathan, can you move to the next slide, please? In 2015, an omnibus early learning bill titled the Early Start Act required the department, it was then the Department of Early Learning, and now we are the Department of Children, Youth, and Families, to develop a pilot for a QRIS for school-age programs that aligned with our early achievers, our Birth to 5 QRIS. So this created an opportunity for partners to come together to develop a continuum of quality for school-age programs. So right from the very start, we pulled together a group of cross-sector and cross-funded partners to engage in the planning, development, and implementation of the pilot. This included the Department of Children, Youth, and Families, which was then the Department of Early Learning, the Rakes Foundation, Schools Out Washington, Cultivate Learning at the University of Washington, Child Care Aware of Washington, and the Office of Superintendent of Public Instruction, which is our K-12 system partner. We understood that we understood from studies that the quality, intensity, and duration of expanded learning opportunities would make a difference in both the short term and longer term for student academic, social, and behavioral outcomes. And we didn't want to limit this work to just school-age programs, and so we intentionally included school-age and youth expanded learning opportunity programs in our pilot. Next slide, please. Our steering committee quickly got to work identifying a vision for this pilot. We wanted to ensure that school-age and youth in our state had access to quality program outside of their school day. We looked to our Birth to 5 QRIS and took lessons that we had learned, both the successes and the pitfalls, and applied that to our design of the Expanded Learning Opportunities pilot. We knew that the stakeholder engagement and the framing of our messaging and professional development and supports were critical for success. We engaged different program types and did not limit our pilot to just licensed childcare. Our pilot included licensed childcare, such as family childcare homes, licensed childcare centers, as well as licensed school-age programs, but we also included license-exempt, community-based expanded learning opportunities programs, as well as 21st century programs. By engaging this broad range of stakeholders, we were able to build a system that represented the Washington expanded learning opportunities landscape. Right from the start, we worked to make sure that the Expanded Learning Opportunities Quality Initiative was aligned with the standards, the competencies, and the assessments used in the Birth to 5 QRIS. This was important because our goal is to have a connected continuum of high-quality program for children from birth through adolescence. We don't want parallel systems, we want connected systems. This has been exciting work, and I'm really pleased to be able to pass the mic to my partners in this work, Juliet and Sheely, where they'll share about the pilot study, the lessons we've learned, and where we hope to go from here.
Thanks, Rachel. This is Juliet Taylor, and I'm going to be talking a little bit about the 2 years of research and evaluation that we were able to conduct on this pilot. And so, you know, we have a lot of data to share, and I'm going to be sharing some highlights. Jonathan, go ahead and next slide. Just like Rachel referenced, this is a sort of a description of the program site types that were included in the pilot. And that included programs who were already participating in our early learning QRIS, both family homes and childcare centers, as well as both licensed and unlicensed school age programs and those serving youth in sort of unregulated care and or in 21st century community learning centers. So it was such an incredible effort to bring all of those partners together and to map out how we could represent them all in our research methodology. You can see the state of Washington in the corner here we leveraged areas where we had already been doing some deep quality work. So Schools Out Washington, our partner in this work and main intermediary providing training and technical assistance to school age and youth development programs, had been doing a lot of work in King, Pierce, and Spokane counties already. And we added Walla Walla to our pilot study to ensure that there was representation in a more rural area of the state, and to also make sure that we were sort of balanced on the east and western sides of the state of Washington. Go ahead, next slide. So in the first year, we really wanted to examine whether this quality intervention that we've been working on actually works. So we took a quality intervention that had been used previously by our partners at Schools Out Washington and intensified it in terms of coaching frequency, and also made sure that it aligned to the Birth to 5 system. So the intervention itself, when I mention that, this is what I mean by it. It is data collection using a national tool from the David P. Weichert Center, both the Youth Program Quality Assessment and the School Age Program Quality Assessment. And from here on out, I'm just going to call these the PQA to make it a bit simpler. But we use that data to inform coaching goals. So every site that participated had a coach. For sites that were early achievers sites or participating in our quality rating and improvement system for early learning, they already had assigned coaches. And so we leveraged those coaches rather than assigning a new coach and trained them in ELO content to make sure we were looking at how this could really scale within our system. And then we had weekly coaching. So we were supporting programs all along that intervention. We also, in year one, had programs take video every week of their program. So they took video at the same time every week so we could look at the interactions over time, and we could code what that quality improvement looked like throughout the intervention. It was a lot of work for these programs that participated, and we really greatly benefited from all of the work that they did. And I'll talk a little bit about how that's repurposed for professional development later. In terms of the research, we used a methodology that allowed us a couple of different things. So we had staggered starts where different areas of the state and different program types started at different times during the intervention. And that allowed us to really ensure that we were measuring quality improvement, and that we could sort of say when we found something, we knew it was about the intervention and not necessarily about the geography or the program type. We also were able to use a design that allowed us to make changes in coaching practice over time. So rather than a research methodology where we did a pre-assessment and then did the intervention and then a post-assessment so you don't really know what you get until the end, we were actually using a methodology that allowed us to make some refinements over time and measure quality improvement. We collected both qualitative and quantitative data to look at the sort of the process. Does this work for people? Is this something that's welcomed by programs, particularly for those programs that were also participating in the early learning QRIS? Did this feel like it was too much of a burden, or did it align with the work that they were already doing? And of course, we wanted to know if the intervention did in fact raise the level of quality as measured by the PQA tools. Next slide. So here are the results of what we found in the year one intervention. And I'll just go through some of our top takeaways. So the biggest takeaway is that we saw improvements in all domains of the PQA assessment, really showing us that the intervention works. And we did find some other pieces of information that were pretty critical. So one thing to note when you look at the chart on the right is that those are the domains of the PQA assessment. And nationally, it's pretty common for safe and supportive scores to be fairly high. So that's the national data that the Weichert Center has. And so we were not surprised by those results, but we were very pleased to see that the scales of interaction engagement, two pieces that are really emphasized in our early learning QRIS, that those also showed improvements during the intervention. And those are, on average, nationally, harder to move the dial on. Some other takeaways we found is that when coaches were using an evidence-based coaching model and they showed fidelity to that intervention model, we saw better results. And then also, not surprising, programs who had lower quality scores at their sort of baseline before the intervention started, they showed the most gains over time. Okay, next slide. So we were lucky to have some continued legislative support in the next year, which allowed us to continue our research and really look at how can we refine some of the things that we learned and also replicate our research. And thinking again about scaling, thinking about the relationship between early achievers and this quality system, and again, hearing back from the field about how things are received and what refinements we can make. In this year, we really focused on asking questions about the mode of coaching. We knew in year one that coaching and fidelity to an evidence-based coaching model, those were the keys that showed quality improvement. And so we wanted to break that down, understanding that we probably wouldn't see the same amount of funding that we do in early learning. And so how could we scale this or consider scaling in our state using a lower cost model? So we looked at 3 different kinds of coaching. We looked at coaching that was all in person, and this was a 10-week intervention. We looked at coaching that was sort of a mix. We call it a hybrid model, where for the first half of the intervention, programs received in-person coaching, and the second half, they received virtual coaching using a virtual coaching platform that I'll also talk about later. And then we also used a mostly online modality. And in the mostly online modality, there were some touch points in person with programs to sort of solidify that relationship piece. So they met 3 times in person and did the rest of their coaching online. We made some structural changes in year 2 based on some of the work and some of the learnings in year 1. So for instance, we looked at changing coach structure to full-time coaching and having the coaches complete the same types of training. And then there was some relief to programs. We did not take video every day, every week. And we also used the new Weichert Center tool, the Social Emotional Learning PQA, which has been an addition to those tools and is something that we continue to use today. The program compilation was a little different in terms of we lost some programs and gained some new ones, and then many continued along with us, and we continued to focus on the same areas of the state. And again, thinking about those explicit ties with our QRIS and gathering the qualitative data to go with that. Now, next slide. So here are the results of the intervention on year 2. And so what we found, if you look at the chart, was again, we replicated the results of year 1 and found that the intervention was successful. And it's notable that this was a 10-week intervention. So we saw changes in a fairly quick amount of time. And so when you look at the different modalities, you can see that the most significant increases we actually found were in the mostly online version, which we found very interesting, compelling, and are still thinking about how those results sort of interact with our whole system from birth to adolescence. And then we tried to estimate some of the costs associated with this and found that if we were able to really scale online coaching or mostly online coaching, that cost would greatly reduce the intervention, particularly when considering the scale and travel times to more rural locations. And then here are some other things that are not necessarily noted on this data chart, but really important to the system. So the coaches gave us a lot of great information, and particularly those coaches that had been participating already in our early learning QRIS, who were now working to support ELO program quality. And what they told us is that when they were able to really focus on discrete goals, it really worked. So in a quality rating improvement system, programs are often having to think about all of the quality standards in a QRIS, where this intervention, programs were really able to focus deeply on 3 goals, and that seemed to really help programs be able to feel successful and to move a lot of program quality. We also found that team coaching was pretty successful. So rather than having coaching be a one-on-one experience, that often multiple providers and sometimes administrators were able to go through coaching together, and that seemed to be a successful part of the intervention. And then another piece was that coaching worked really well when leaders and administrators were involved. And part of that is just so that, you know, administrators who are making decisions around costs and resources, if they're bought into the intervention, if they understand the quality improvement efforts, then they can support the program to really make a lot of gains. And then finally, when we looked at the qualitative data, programs and coaches really liked the idea of trying to refine this hybrid model and really thinking about choosing the best fit of coaching modality based on program preference and readiness. And so there were some, you know, some takeaways about, wow, we saw significant results in this virtual modality, and it's nice to be able to kind of ensure that we had some time for relationship building and choice programs. Next slide. So the thing that we were able to during the I've mentioned the PQA tools, and my colleague Sheila is going to talk more about those tools in depth. But Washington also took the opportunity during this pilot to develop our own tool called the Quality Seal Assessment. When we originally thought about bringing the systems together of early learning and ELO, we thought about how we might objectively assess quality improvement in ways that aligned with our current rating system. And we had some lessons learned and some consideration from our Birth to 5 QRIS about not wanting people to, or programs and providers, to focus too deeply on the assessments, but using a tool that could help with quality improvement and data along an intervention, and then be able to come through with a measure every so often to look at maintaining quality improvement and looking at quality threshold scores that would align with child and youth outcomes. We also wanted to build a tool that didn't have ceiling effects, so that programs who would be able to sort of score 5 in all areas, if 5 was your top score in the Likert scale, that, you know, we could really differentiate between those programs who had top-notch quality and those who were doing really well but still had a significant amount of room for quality improvement efforts. We built the quality seal and tried to simplify it by naming what we called the big 5 domains. And so you can see the domain titles on the slide. We did not focus on health and safety, but we really looked at what are the domains that really connect with youth outcomes. And so we emphasized higher level quality components in the quality seal. We separated the coaching tool, or the PQA, that would help programs look at and measure their quality a long time in a coaching relationship, from this overall mechanism that could be aligned more with the rating process in a QRIS. And we looked at the validity and concurrent validity of these tools. Does the quality seal measure the PQA? In other words, if you score well in the PQA, we found that you will be also working toward higher quality in the quality seal. So now I'm going to turn it over to my colleague Sheila, who can talk more about the Likert Center tools.
Thanks, Juliet. And we can go ahead and move to the next slide. So from the program perspective, we, as Juliet mentioned, we wanted opportunities for programs who are engaging in continuous quality improvement to be able to utilize data and really drive their improvement process, and also have those tools be different from an evaluation process. And so programs utilized in the first year the youth PQA, which is a validated tool that looks at measuring key developmental experiences, or really the staff practices that support key developmental experiences. And then starting from the second year forward, move to the social emotional learning PQA, which that is the pyramid graphic that you're seeing here, shows sort of the different domains and scales of practice that are embedded in there. And what we really found for programs, and what we hear repeatedly is that they really get to take ownership of the continuous improvement process, and that the way the tools are designed is that they can both serve not only to measure progress over time and really standardize measures of practice, but that it also actually just lists standards of best practice. And so supervisors, managers will use the assessment tool not just for one-time self-assessment and sort of setting goals, but also in onboarding processes or introducing staff to the practices that they want to have embedded and carried out throughout their program. And so we just, again, the way that programs utilize this is they would do a self-assessment at the beginning of the year with teams where they observe each other and take turns, utilizing the tool to observe and then measure on a 1, 3, 5 scale. So is the practice not happening? Maybe it happens sometimes, or it's happening frequently, and really supports having those conversations. And so to Juliet's point earlier around the benefits of coaching and having a coach work with teams is that this process also supports really building buy-in and support for all of the staff in a setting working together and having a shared language and shared measures of practice that they can then set their own goals and continue to have those conversations. And then we build in the process that after they've engaged over the course of the year in setting goals, working with a coach, attending trainings, and we'll dive into more of those professional development opportunities in just a bit, that they get to self-assess again at the end of the year. And again, as a team, get to celebrate with data that they've collected the successes and the areas that they have improved, as well as sort of recognize those areas that maybe didn't work and have conversations around what's getting in the way, what would they want to focus on moving forward. Maybe it's an area of focus that they actually just need more supports or resources, or maybe it's an area in their practice that just doesn't quite fit with their mission and vision and content areas of their program. So again, continue putting the tools into providers' hands to really guide their continuous improvement process. And it's also, because it's aligned to the quality seal, we know that it's supporting and building those higher level thresholds of quality. So with that, I think we're gonna pause and take some time for questions.
We are, Celie, and because I don't have any questions in the chat box, I'm able to move forward with my own questions, which I have a ton of. So, Juliet, when you were thinking about, I was going to ask you a question about what surprised you most about the evaluation and what you learned through the whole thing. But when you got to the coaching approaches, that had to be a pretty big surprise, that the online coaching yielded that type of results.
I mean, absolutely, it was a surprise, and you know, we know this is not necessarily a representative sample, and there are some distinctions between our ELO system of quality and our early learning system of quality, but it's definitely a promising approach to explore, particularly when you're thinking about funding scarcity. We have a couple of hypotheses about why we saw those results, and one of the things is, there's this power of video. The coaching platform, which I'll share a bit later on, people are able to upload videos of their practice, of their choosing. So something that it doesn't feel like a gotcha, it feels like a supportive piece of the coaching relationship, where they're able to upload a video of something that their coach and they are working on together. And to really see yourself on film is a pretty powerful way to look at quality improvement. And then secondly, when you do that, you have a really focused conversation. And so, we all know that programs of any type are busy environments with lots going on. And so the ability to really focus in that modality is something that we feel is pretty powerful. And we see that in other settings when it's applied, like our higher education work.
That's great. Like when you did the conversation with either the team or the individual in terms of the coaching, was it like a FaceTime thing, or like were you looking face to face, eyeball, or was it more on the phone reacting to maybe the coaching session on a computer? Like, just tell me a little bit more about how that looked.
So the coaching, the virtual coaching happens through a tool called the Coaching Companion, and we actually use Coaching Companion already in early achievers, and so we were able to leverage that, which is, you know, one of the great things about pairing this after the rollout of our early learning QRIS is being able to extend some of the resources. And so the virtual Coaching Companion platform it has a resource library that has exemplar practice clips, so coaches can use that asynchronously with providers, so they can say, here, take a look at this. And then, so most of it happens, you know, in their own individual time, where, you know, they're able to kind of upload something, they can tag it and say, hey, what do you think of this interaction at, you know, 23 seconds in, et cetera. And then the coach is able to then do that in their own time, review, reflect, feedback. So that sort of coaching cycle happens asynchronously. And that's, you know, and I do know that during the pilot, there was also a lot of touch. So, and Sheila can say more about that. There, you know, there was a lot of coach touch through phone calls and emails. So these programs and providers were getting a lot of support.
I really liked what you said about, and then we have a question in the chat box that we'll go to. I really liked what you said about also the flexibility of having providers acclimated to this type of technical assistance, with the ability to then transform it into peer learning opportunities or teams of people thinking about their space, their rooms, what they're planning, you know. So the ability to either pull out to a little bit larger group, or there can be an exchange between different facilities or teams, right? Or be able to drill down to kind of a one-on-one. It gives you a lot of flexibility with the approach you'd use. And I'm sure in your support of the TA folks, you're talking about, you know, those opportunities and when is the time right to bring in another discussant, so to speak, or somebody else. So I just thought that was really promising, especially when we're looking at a large state like Washington, and travel time and, you know, the kind of lost hours with a TA person out on the road, you know, and the development here also of these strategies in the face of what we're facing with the epidemic and, you know, numbers of sources of people you want in settings and stuff. There's a lot that's really promising here. And I'm kind of also just hearing what you're saying and taking it to really technical assistance in general and supports to programs. We have a question in the chat box. Were the pre and post assessment results shown from the were they external assessments or self-assessments? I think is the big questions here.
Yeah.
And was there reliability training, and are people, you know, is there a cadre of reliable assessors? If you could talk a little bit about that part of it.
Yeah, I can speak to the PQA side of it, and then Juliet, if you want to take the second part around for the quality seal, and then the questions around that are in the chat about ERS in class. But for the PQA, for programs that did self-assessment, they did also get external assessments using the PQA tool as well. And those external assessments, those assessors do go through a reliability training process with the Weichert Center, and then also the University of Washington's data collectors were also trained in the PQA tools for reliability, and actually continue to do much more intensive inter-rater reliability for the research studies themselves. But for providers and the programs participating, they do get their data reports. So they already know their self-assessment scores, but we create reports that show their self-assessment on the PQA a lot compared to their external assessment scores, and a nice kind of readable report. And we actually have a training, which we'll talk about later, where programs get to learn and build their skill around interpreting data, reading data, helping to kind of think through what does the data mean, and how do we set goals based on that data. So they they get lots of supports through that. And then same at the end of the year, they get to see their pre-assessment scores compared to their post-assessment scores. And again, get to have practice sort of, you know, interpreting that data and celebrating their successes where there was improvement, and then having those conversations of where maybe they didn't see improvement or sometimes the scores go down too. And then Juliet, do you want to share about the coaching model and the other assessment tools that
Sure.
early achievers programs were using?
Yeah, absolutely. So as Shirley mentioned, we have a pretty robust reliability process at the University of Washington for our early learning QRIS and reliability checks, et cetera. So we did build that into the quality seal as well. So all of the assessors were reliable on both tools. And then in terms of the coaching model, which I'll go into a bit later, it is the practice-based coaching model. So we use that model throughout the quality system. And again, it's used in early achievers, so we were able to leverage that work and think about extension to the ELO population. And then finally, there's the question about birth to 12 facilities. They were doing the ERS in class. And so one of the things that we looked at early on was how do we not have programs have an assessment visit where all of these things are happening at one time. So some of the inclusion criteria for programs that participated, we sort of looked at those pieces to make sure that there weren't too many assessors going in at one time and programs weren't overloaded, especially if they were going through the QRIS system, which is tied to tiered reimbursement. So we wanted to make it feel as low stakes as possible, but we do use the ERS in class. At the time, we were using both tools in the early learning system.
Did you have your standard operating practice about how to bring on board programs to the tools? Like, that takes a lot of effort and training. You don't want to be going in with a surprise tool. You know, you want people to know what the assessor's looking at and all that. Was that a substantial piece of work in your setup here? Training programs in the PQA and your other model?
Yeah, we had, and we'll talk a little bit deeper about this in the next section, but programs spend actually an entire day learning about the PQA tools in a basics training where they get to understand the structure of it and actually practice utilizing it and practice their skills of taking observation notes, which is the way that you score the assessment tool. So they get practice with that, plus as we'll share more, like our coaches.
Well, then maybe we should charge ahead to the next section, right? It sounds like we're starting to get into the wondering about what's all around this, and I think that is, let's head forward.
All right. Which I think the next section is professional development and coaching. So I can kick us off on the next slide. There are, actually, if you can jump to the next one. So the one thing I don't know if we explicitly named, but all of in addition to using research-based and practice-based coaching model, providers also engaged in the research-based youth program quality intervention for continuous quality improvement. And that was developed by the David P. Weichert Center for Youth Program Quality. And so that really does consist of sort of assess phase, planning, and then improvement phase. And within that system, there are supports all along the way for providers for every stage of the continuous improvement cycle. And we also took the opportunity during the first 2 years to really hear from programs what their needs were in addition to the trainings that were already built into the process. And so from that, which Juliet will share more about, we were able to develop 2-minute tips because we were hearing from providers that they can't always come to full day trainings or even 2 or 3 hour trainings. And so really wanting ways to just dive in quickly to different practices. And then also thinking about the value of online learning and support. So we were able to utilize resources to develop some new professional development opportunities. And if you can jump to the next slide. So to your question earlier, Debbie, about, how do we onboard programs to utilize the assessment tools? So the basics training really is a full day, like how do we do self-assessment, really reinforcing the notion that particularly with the PQA, it is meant to be low stakes, it's meant to be team-based and collaborative, and really spending time just getting to know what's in the assessment tool, being really transparent about it, how the measures work, what the practices look like, and then really supporting programs to engage in that self-assessment process. And well, Juliet will talk about practice-based coaching. We really did also ask coaches, invite coaches to really be a part of that self-assessment process too. So coaches are there supporting programs and even thinking through how to plan out their observations or help co-facilitate their team-based scoring meetings. And then once they have all that data, the programs are then guided through the planning with data training, which again helps teach them to how to read the reports and comparisons and really start to build their skills around data, like reading data and then setting goals, and how do we set goals based on data, but also goals that are meaningful and still aligned to the values and goals and the young people that each provider is serving. And then from there, they're aligned what we call methods, youth work methods workshops that are aligned to all the different practices in the PQA. So if programs saw that they weren't scoring well, let's say in doing reflection practices, and they set a goal that they really want to embed more reflection opportunities, there's a 2-hour workshop that really actually teaches staff to do that. Over years 2 and 3, programs were able to, we also developed social emotional learning methods workshops. And so really we saw programs start to go much deeper in how do we support emotion management, empathy, problem solving skills, deeper teamwork and collaboration skills. So we had lots of already built in professional development trainings, but really where programs, I think, appreciated the most, and this also speaks to your earlier point around how do programs leverage the opportunity to connect with each other. And so from the beginning, we built in peer learning communities. So each region had, and each year had anywhere from 3 to 5 learning community meetings that usually paired a training opportunity. So the first learning community meeting usually consists of just orientation to the process. That's where we introduced the quality seal at a high level, so programs knew what that looked like at a high level, but we didn't spend like a deep dive looking at every single practice in the quality seal. We really wanted to keep the tools separate and really have programs focus on the PQA tools for their own use, but still introduce the process so there was transparency, and so they knew what to expect. And then as you move throughout the year, they had time to practice skills with each other, to share challenges and successes, and really build a community with each other. And what we would see is that then programs, for those who were doing in-person coaching and even in the virtual setting, would start to collaborate with each other and have joint coaching sessions with each other and with a coach. And at one point, we also developed online communities of reflection and practice. And what we saw was even to encourage people to utilize the tools. It was interesting to see like sort of regions kind of would challenge each other on like posting their best practice videos, or like adding new resources, or really trying to like show that their region, what all the different quality practices that they were doing. And so that was just, I think, another key learning that we didn't necessarily measure explicitly, but heard continuously in focus groups from coaches and anecdotally, like how important these peer learning communities were for programs and continue to be. And so with that, I think we will, Julia, I think you're gonna take over to, one more additional thing if we go to the next slide. One point I wanted to make, so those were all the trainings that were aligned to quality. And Jonathan, if you can jump to the next one. Thank you. Simultaneously, Schools Out Washington is also supporting and offering professional development opportunities for our standalone licensed school-age childcare providers that were serving school-age children, so separate from early achievers programs. And so we've, for many years, have been hosting community workshops, webinars, symposiums. We do an annual Bridge from School to After School conference that really is for across school age to youth development. And what we found and noticed is that because of the ELO quality initiative, we started seeing actually more of our early achievers programs that were serving school age children start to attend some of these other offerings and really start to get more supports around school age specific learning. And so I think for me, that just speaks to how we were able to, in an informal sense, already start to bridge some of the gaps or bridge some of our two systems together. And it's just really encouraging to see even our partner agency, Childcare Aware, who's really serving early learning childcare, and Schools Out Washington over the last 2-3 years, we've already also started to see like deeper partnership and alignment. So even as we continue to build out this system, the relationship building, the connections, the seeing of where our respective initial systems, like our skill sets and strengths that we bring, starting to share those and collaborate more. So just a few ways that that's shown up informally already with our professional development opportunities. So with that, Juliet, do you want to share more? Go ahead and jump into coaching. And
sure, Jonathan, next slide. Thanks, Sheely. So I mentioned some of this already in the sort of Q&A portion, but in Washington State, we use practice-based coaching, and you can see the elements of practice-based coaching, which is a cycle where we make shared goals and action planning, have focused observations of practice, have the ability to reflect and provide feedback between the coach and provider, and this is all done within a collaborative partnership. Practice-based coaching is used in early achievers, so we were able to leverage that for this pilot and also build off the deep work that our two intermediaries are using to support that sort of foundational coach work and relationship-based approaches. So both Schools Out Washington serving the ELO population and Childcare Aware serving the early learning population, they really ground our coaches in relationship-based approaches, and then practice-based coaching is sort of the methodology we use on top of that. We also, as I mentioned, have this virtual platform called Coaching Companion, and it is a totally online tool that allows for a lot of flexibility. I mentioned some of the abilities that Coaching Companion has. One thing that I didn't mention yet is that there's also the ability to have closed communities of practice in the Coaching Companion, so coaches can also invite a number of providers to enter a community of practice, and they can do some discussion boards or some work together and in reflection and feedback cycles as well. During the pilot, I mentioned that we made some adjustments between year 1 and year 2, and the other thing that we were able to provide coaches is access to a coaching certificate at the University of Washington that focuses on grounding coaches in practice-based coaching. And so this is a coaching certificate that's totally online now, is available to any coach that's interested in learning more about practice-based coaching. And it was a way for us to ensure that all the coaches that were working on this project had consistent training and had consistent support throughout the work. The coaching certificate focuses on culturally responsive coaching, relationship-based professional development competencies, data-driven goal setting, action planning, and the focus observation. So people are really able to dive into the various elements and practice using the Coaching Companion themselves before they might use it with providers in the field. And then the other thing I think that is worth noting is that Schools Out Washington and Cultivate Learning team members did a lot of work to support coaches. So, you know, Sheely, I can just say that Sheely was an amazing resource to programs during this pilot, working to have all coach meetings throughout the project, lots of communication. As I mentioned earlier, the ability to do some brainstorming and planning and sort of strategy around coaching practice with coaches throughout the life of the intervention, and to also offer one-on-one support to coaches. So, you know, in a pilot, that level of intensity was possible. When you think about implementing to a state system, that is probably not going to be able to be scaled, but we found it to be really, really successful in supporting the coaches. Okay, next slide. So Sheely also mentioned a couple of professional development things that we were able to work on. I should mention that in our system, we're really, just to simplify, we're really looking at combining the amazing materials, resources of the PQA and the Weichert Center tools with additional professional development and additional training in our QRIS system so that we have sort of this continuous, robust Washington State system that includes both the PQA and some additional professional development. When we were doing focus groups and the qualitative research during the 2 years of research studies, we also asked the field about, what do you need? What are some areas of professional development that would be helpful? And programs, one thing that was really a foundation in Washington is that programs really love the PQA. They love all of the training. It really resonates with the work that they do. It validates the work that they're doing with children and youth every day. But we did see that there were some gaps both in the data and from what people told us. So one of the things that programs shared with us is, even more than early learning, programs don't have the resources to attend trainings. They don't have budgets, and we looked at this. What are the sort of typical budgets that programs have to support ELO, continued professional development? And it is, not widely available. And so programs are really doing their best to just keep the lights on and have need for keeping institutional knowledge about quality improvement, but also helping ramp up new staff who might be joining program to learn some of the basics as they're starting their work with young people. So we developed something called 2-minute tips that you can see here on this slide. And our tagline is, you have 2 minutes, then take a look at a 2-minute tip. And we developed this at Cultivate Learning in response to the field feedback so that we could really look at a research-based practice and take just almost no time at all to present this information to people where they could see, here's why this particular practice is important in terms of the research, the relevance, like why do we care about this topic? And then more importantly, what are some ways that we could apply this in our program setting? So some direct application and concrete ideas to try in programs with support of coaches. If people want additional information, there is always references and additional resources that are listed. But this is kind of what a 2-minute tip sheet looks like. The other thing to note is that, remember all of that video that programs were collecting every week for us in year 1 of the pilot? Well, we were able to repurpose that with consent to show exemplar video. So every 2-minute tip has a theme, a research base, and then also you can see a practice in action and a video link. And so that, when we talked to programs about it, they really loved that component, seeing themselves and Washington programs in action, but also it just gives another sort of learning style to the professional development mechanism. We also at Cultivate Learning were able to go around to some extraordinary programs in ELO and take other exemplar clips. So that resource library I talked about in the Coaching Companion is slowly getting populated in Washington State with more and more ELO resources. Next slide. And then finally, we, with generous support from the Riggs Foundation, one of the private partners in this private-public partnership, we are finalizing some online learning modules that, again, will be available to anyone in the nation. It's focusing on supporting school age and youth development practice. Each of these sort of modules will be 10 continuing education credits. And you can see that the breakdown of the content. What we found, especially as we started the pilot, is that programs really needed a lot more around social emotional learning tips. And as Sheely mentioned, that's now in place through the Weikert Center tools. And then these are some additional resources that will help programs. And then the other practice we heard a lot about was just more information around youth engagement and ensuring that people had information and support to think about, different from early learning. We really want youth to drive programs. We really want youth to have leadership opportunities and quality ELO programs. So those modules are all about that important work. And the modules will be done in June timeframe and posted on the DCYF website so that people are able to access that. And now I think we're on to a break with questions.
Well, we do have some questions, but I want to make sure that I heard this correctly. Though the modules and some of these materials are available to states to inculcate into their TA or school age approach. Can you just clarify that a little bit more for us? Because that is exciting.
Yeah, so the 2-minute tips are actually up now on the Cultivate Learning website. At the end of the webinar, there'll be a resource list. And so their website's listed. So it will take you to the link, and it's divided by various content levels. So you'll see things like content topics around cultural responsiveness, family engagement, safe and inclusive environments, etc. You can pick on the heading and then find a variety of 2-minute tips underneath that. We haven't totally populated, there'll be more, but you can access that right now. And yes, the idea is that when the modules have been developed, that would be available nationally. They are all online. And so different state systems can use them in ways that support their work.
That is so exciting. I also just want to go back to the coaching credential. I know that states are working to think about the quality and the support of the coaches within their state. Did you say that coaching certificate is available nationally as well?
It is, and that is new in our system. So the University of Washington has built the coach certificate over time, and just this year we moved to a fully online version. We are still doing work to more intentionally build in ELO focus, and that's sort of the work that we're doing right now. But it is open to coaches across the nation that are interested in using practice-based coaching. We went all online, and if people are interested, we have information we could send out about signing up for the next cohort.
That's really exciting. With the practice-based coaching, is that kind of seen as a tool in the toolbox of the technical assistance or coach? Because it doesn't get quite as much to how are they working at a more administrative or whatever level on their CQI planning and on their, you know what I mean? Yeah. Broader than the classroom in terms of the CQI approach. So it's one piece of what a coach might know and be able to do. Am I correct in understanding that right?
That is correct. You know, I think it is a tool, and it is something that is really meant to move practice at the interaction between adult mentor and child or youth. So Sheila, you probably could talk a little bit more about the supports that SOA does for these other pieces that are so valuable, important to the system, that it do include some of that administrative support.
Okay. Do you want to do that now, or do you want me to go through more questions? Which do you prefer, Celia? Which do you think is better?
I think actually with the way Juliet framed it is really that coaches did and continue to support sort of holistic level of support, all like organizational level and broader programmatic level when they are coaching. And that's actually like part of how I think coaches really see themselves as really as overarching service to programs. We have actually from the lessons learned, and I think in year 2 or 3, the years blend together, we Cultivate Learning and Schools Out actually did draft a readiness assessment tool to really think about sort of the organizational, structural, and policy pieces that really help programs and providers to engage in continuous improvement and to really leverage the ability to work with a coach on practice at that interaction level. And so that was something that we are continuing to explore, like how can coaches moving forward, or as we think about scaling, how do we support programs that maybe aren't quite at that level to be able to engage in intensive coaching on specific staff practice, but really need some of the organizational and structural supports first. So Julia, I don't know if you want to speak more to that readiness assessment piece as well.
That's just such a, I think you framed it very, very clearly there. That's great. Continuing on the coaching, I want to get to some of the chat box questions. Can you give us a ballpark about the coaching caseload you used during the pilot?
That is a great question. For the early achievers coaches, and Juliet, maybe you have a better sense. So for the pilot itself, the caseload was really 3 programs max for any of the early achievers coaches in the pilot. For the school age coaches that were the Schools at Washington coaches, they, for the pilot, had caseloads that were anywhere from 5 to 10 programs. That being said, the Schools at Washington programs and the early achievers coaches also had caseloads of sites that were outside of the initiative. And Julia, I'm not sure if you know the number of like the average caseload for an early achievers coach.
I mean, it varies based on region. They have a pretty, you know, they have a large caseload for, you know, QRIS in general, because we are scaled across the state. And so we were mindful of that. You know, one, we didn't have the majority of programs that participated were not early achievers programs. So those coaches took on a few, as Sheely said, in addition to their other caseload.
Okay, great. I just wanted to clarify real quickly, this was a question that's been up for a little while. What were the funding sources for the pilot?
So the funding sources were a few. So I mentioned we had a private-public partnership. So the pilot itself, when Rachel opened with this sort of legislative information, we did have continual legislative support throughout the pilot. And so, you know, we had some funding that would allow us to do part, but not all of this work. The other portion was funded by the Rakes Foundation, a private partner in this work, who had funded quality work in ELO programs for nearly a decade. So very invested in ensuring that that investment was going toward building a more public system, recognizing the critical nature of ELO in general. And then we also had partner funding, some partner funding from OSPI. So it was great that both state agencies, DCYF and OSPI, our K-12 state agency, contributed funding. You know, as we mentioned, the OSPI administers all of our 21st century programs in Washington State. They too had been using the PQA historically. So it was sort of this really amazing alignment that came together.
Yeah.
Blending of funding streams. And we've, you know, what we found is that, you know, there's so many initiatives follow the funding, and we were really able to follow the actual landscape of the field by having that collaboration of funders.
Well, while you're talking about that, we had a second follow-up question. Did the 21st century align their monitoring visit with the pilots? Like how did the interaction between the pilot and the 21st century work or play out?
Sheely, I'm going to kick that one to you. I mean, you might know more about their monitoring process.
You know, I don't know as much about the monitoring process. What I can share is that we were, because OSPI was also a key partner and in the design process from the beginning, we were really intentional about how we did recruitment for 21st century programs, really ensuring, so all the 21st century programs in Washington have been and are currently utilizing the youth program quality intervention and the PQA tools. So from that aspect, they were already really okay with, like, PQA and continuous improvement was embedded into their grantees' contracts and process. And so we were able to make an agreement that any 21st century program that was participating in our initiative didn't have, like, they could count that as their grant requirement for continuous improvement. They didn't have to do a separate process.
Great. Where policy works for the provider. I love it.
Yeah, exactly. And for the first couple of years too, OSPI actually contributed additional dollars to really support the rural programs in Walla Walla to engage because of the additional, like we had to send trainers there and coaches there for the first year because we didn't actually at the time have a coach available in Walla Walla. And so from that standpoint, again, we really tried to work to partner and figure out what would be best. And my sense is that the way the monitoring visits worked is because 21st Century was already engaging in continuous improvement, they had designed a system where it wouldn't interfere with the process of continuous improvement when they have those monitoring visits.
Right.
But yeah.
Just to follow up finally with a couple of quick questions in the chat box. The 2-minute tips are shared with the caregivers. I think I heard you say they're posted online, but I'm assuming that the TA person, as applicable, like drives the tip sheet to a provider about a question, right, as well. So either they can go explore them or the TA is directing the tip sheets. Is that correct?
That's correct. And when we kind of get to the next phase about, so how are we applying all of this pilot work in Washington State, there may be other mechanisms that we use to intentionally disseminate the tips. But yes, through coaching and just available open on our website.
Great. One final question. Is the readiness assessment tool widely available? Access to the readiness assessment tool. We had a question.
Yeah, Juliet, do you have thoughts on that?
Yeah, it's something that we haven't finalized yet. Actually, part of what we're looking at with the readiness tool is, and we'll talk about this coming up, is thinking about the applicability across the continuum of programs from birth to adolescence. And so we're kind of going through this process of saying, we don't want to duplicate efforts. And so maybe there's some really cool stuff in this readiness tool that Shuli mentioned that we don't ask and support in early learning. And so while we're looking at getting the systems to sort of talk to each other in seamless ways, we may modify that. So I think the jury's still out about how we're gonna publish that field.
Great. Well, thank you so much. Okay, let's charge ahead.
Okay, great. So I'm just going to talk a little bit about some pieces of actually the build report. So when we were doing all of this work, we just at some point thought, this is such an awesome process, very difficult, challenging work, but the right work to take on. And how can we really capture the story of what happened in this, sort of building continuous systems and thinking about building a quality system, not by just extending our early learning system, but by really looking at the different realities, developmental considerations, funding pieces of looking at school age and youth, and then trying to connect it. So we asked Bill to sort of do this external evaluation, and many stakeholders who were deeply involved in this work were able to weigh in. I think Jonathan's going to make that available to people. It's an easy read, and I think it really captures the spirit of the collaborative partnerships and the continual questions that we still have work to do on. So Jonathan, next slide. One of the big pieces that we're thinking about now, how do we bring this all together? The pilot was, as I mentioned, an intensive intervention, and much of that was due to the evaluation, right? We really wanted to think about, is this the model that would be scaled eventually? And so we were able and had lots of funding partnerships to be able to do that work before thinking about implementation. Now we're at the point of, how do we connect these two systems so that they're distinct in ways that honor the differences in the field, but are also seamless, so that programs that are serving children birth to 12, as many of our early achievers facilities are, have that kind of support and attention to ELO methods, practices, and ensuring that those organizations can involve everybody in their quality improvement efforts. So the next couple slides talk about some of these findings from the build evaluation. And the first one that is always a big issue when you're thinking about systems is the funding considerations. Some takeaways from our work is that, braiding, which is always, the magic word, was really critical to this. As I mentioned, we had private support, we had public support from both state agencies, and that made a big difference. The private foundation dollars are things that stood up the evaluation. And they also supported some of the additional professional development that we use in our system. And so, you can be very creative when you have private support to go above and beyond and really answer the critical questions you have before scaling an intervention. It's really important to have designated funding agencies in Washington State, because we have, at the time when we started, the Department of Early Learning was a birth to 5 or birth to 8 agency, and since moved to the Department of Children, Youth, and Families, which is looking at the continuum. So it was this perfect alignment for us to think through the continuity of systems. But it is important to have someone who is sort of monitoring the progress of this at an agency level. So, someone that owns the work. And for many of our youth development programs that are not regulated by any entity, they can get lost in the shuffle. So this pilot was really allowed us to raise the visibility of, you got to have an agency sort of, bringing in dollars to care about this work deeply. And then finally, sustaining funding, which is always a difficult one over time, and really embedding in the public system, absolutely requires champions. It requires people who are willing to try new things and adapt from learnings, and who are really visible. I will say I've had the pleasure of working with Schools Out for a long time, and their advocacy efforts are so present in Olympia, our state capital, to always raise the visibility of school age and youth development and how that ties to our early learning system. Next slide. So as I mentioned, this continuum is something that we continue to grapple with. How do we build one continuous system of quality? And the way that we're thinking about that is through our QRIS, and ensuring that, as Debbie mentioned in the beginning, those children grow up, and quality is so critical in ELO programs as well. One of the things that was actually surprising to some of our early learning leaders was learning about how much time that children are spending in after school and summer learning programs. And just like our early learning quality focus, we need to make sure that those programs are supported to do their best work with kids. I've had the experience of working in both early learning and ELO sectors. And I will tell you that the ELO sector is just full of passionate people who come to this work, and they're mission driven, just like early learning counterparts. So it's really critical to have this outlook from the beginning around, we really want to support a continuum, and how do we do that in ways that also support the distinctions in the ages as time goes on. And then I'm going to turn it over to Sheely to close it up and talk about the work that we're doing to integrate this continuum in Washington State.
Thanks, Juliet. Yeah, so as we think about our next steps and sort of what we can really do to move forward and scale this, we're starting with, right now, we have a design team working together with all of our different partners, from Childcare Aware to Schools Out Washington, OSPI, Department of Children, Youth, and Families, to make recommendations in terms of a next step of how can we embed what we've learned and the strategies and quality supports that we've had in the Expanded Learning Opportunities Quality Initiative into early achievers programs, or our early learning programs that are serving school-age children. And so we're really taking, we've been taking the past several months and are close to drafting recommendations of what could that look like. But what I've appreciated as Childcare Aware and Schools Out Washington have really again, grown in our partnership and collaboration, particularly over the last 2 years because of the ELO initiative, is that we're really taking into account, how do we engage providers and engage their voices in this process? So not only those who participated in the initiative, but those who didn't participate or who weren't able to continue, to really make sure we're taking those lessons learned and designing supports in a system that is going to be responsive and supportive to support all of our young people. And so with that, some of our resources we just wanted to share on the next slide. Juliet mentioned, so to access those 2-minute tips, you can access Cultivate Learning UW's website to get the expanded learning opportunity 2-minute tips, as well as read more of the full reports from the research studies and a host of other resources. And then we also include Schools Out Washington to kind of see the host of different professional development opportunities. And you're welcome. We also actually have a COVID response page right now that has more supports if you're curious to see how we're working to support the field in this current pandemic. And so with that, I'll turn it back to Debbie.
Thank you. I would just like to say that this session has been so informative and interesting, and I'd like to thank you both, and Rachel as well, for sharing your perspectives, what you learned. I think there is a great deal of applicability of your pilot, especially in the TA side, to general supports for programs, really even birth to 5, as well as in the school age space. But it's just interesting to have walked through with you what the technical assistance, the tools look like, the project and pilot looked like, and to be thinking about how is it moving forward in the work in Washington. I think when we were doing at the very beginning of the session, the wonders and wows and worries, one of my worries was that we might drift back to a custodial care thinking about and not keep alive our aspiration for providing worthwhile endeavors and efforts for children outside of school to be doing, whether in early childhood or in out of school programming. And you've really given me a lot of hope about no matter where the program's coming in and starting, and maybe they'll devolve and take a few steps back during this time, but we'll meet programs where they are, and we can still have our vision and thinking about moving forward to provide worthwhile time for children and families, and really maybe fine-tune even our support for providers and how we're looking at that, and how we're conceptualizing helping providers improve. I think what I really liked also about what you were saying, and I've talked with a lot of state leaders across the country recently, was how you're listening to providers and incorporating their viewpoints, their feedback, and how truly to create the systems that best serve the providers. The provider and family voice is key to the endeavor of providing high quality. But I'd like to offer you each a moment to just tell us in conclusion, is there a wrap-up statement that you'd like to make or something you'd like to say as we begin to wrap up? And I want everybody to remember the post-webinar feedback survey before you start to leave the meeting. It really does help us improve the programs. But Juliet and Sheely, how would you wrap up our conversation today?
This is Juliet. I'll jump in at first and say, again, having worked in both sectors, we went into this pilot saying, it's this awesome thing in Washington State that we have years and years of implementation experience with our QRIS, and we can take a lot of lessons learned. When our fearless leader, Gail Joseph at the University of Washington, who was instrumental in developing the early achievers QRIS, we had these discussions early on, like, if you could go back and wave a magic wand, what might we shift? And so that was this really incredible opportunity, and an incredible opportunity to leverage a lot of the things that had already been paid for, and just with a little bit of extra funding, extend those resources so that we could really put attention to ELO. But I will say that in the end, it also was an amazing experience to learn what we did during the pilot and ELO programs and have those learnings considered for the early learning system. So, and there were a lot of stories, and there were a lot of pieces of information that we're now thinking, wow, that's really interesting. Like our, the virtual coaching, or like the team approach to coaching, or the learning community piece that Sheila talked about. How do those also impact learnings and continuous quality improvement in our birth to 5 QRIS early achievers? So it's been a really cool experience to do the cross systems learning. And that's one of my big takeaways from this work. Sheila?
Yeah, thank you, Juliet. Yeah, I echo all of that. And then I've been thinking, and just in our current times with schools closed, just how school-age childcare and youth development programs really are stepping up to provide emergency childcare, and will most certainly, or almost certainly, be serving children and youth before schools fully reopen. And so thinking about that here in Washington, we saw how the systemic silos and lack of integration around public funding and quality systems served as obstacles as government agencies and districts tried to work quickly to address the need for childcare and supports for school-age children during sort of the ramp up of COVID-19. And so for me, I just it's clear, and I hope others maybe we get more momentum or to continue the work that the work we've done with ELO Quality Initiative offers a real path forward. And I just hope we're able to leverage all of those lessons learned and successes to really create a true system of supports for early learning to school age and beyond, and for all of our young people across the state, and hopefully across the nation, as all of you think about how to align systems and supports.
Well, thank you again for sharing your wisdom and what you're finding out and learning. I can tell this story's not over yet, and I think that's what's a lot of fun in Washington. You folks continually examine what you're doing, think about how's it playing, what are we learning, and how can we make it better. So really you exemplify the CQI at the program management level, and that's so appreciated, I know, by all of our participants in the session today. I'd like to thank you again, and thank all of our participants today for sharing some of your valuable time with us. We do appreciate any feedback on the session today, and look forward to speaking with you again in our next Let's Talk. Goodbye.
Thank you.
Thank you.